So the cleft lip and the cleft palate. Two different problems, genetically unrelated. There are some patients that the lip and the palate occur together, but like the lip is 1 out of 1,000 births in North and South America, whereas the palate is 1 out of 750. Okay. Now, interestingly, it's twice that much in Asia, but it's half that much in Africa. We make a fresh incision here, a fresh incision along here, and then we make an incision along here, an incision along here, and then we lift them off the bone, and then we bring them together like this. Oh, wow. So that when you're done, ideally, you would have this would be your incision. Okay, we'll be done shortly.
What?
We'll be done shortly.
Okay, we'll take you there.
So this will be the suture line here where the stitches were. When it all heals up, you see a little very thin little scar like that. So again, this is just a matter of lifting it and bringing it together. It seems easy, which once you have these lifted off the bone and moved over, it's easy to suture them. But lifting them off is the hard part. Okay. The difficult part is trying to elevate this because it's stuck to the bone. And there's an artery that comes out a little hole here and a little hole here. And this artery comes up and gives blood supply to the palate like this. And you actually will see, and we'll show you in the operating room, you can see this artery coming out of that hole. And you have to, if you accidentally cut that artery, this whole flap will die. It'll be a big problem. So you have to be very careful when you work in this area so that you preserve the artery. Wow. And so what happens is that even though you lift off this palatal tissue off the bone, it won't move this way until you actually skeletonize some of that artery. You have to get that artery, some tissue off the artery. So it's technically a much more difficult surgery, and you're bending over like this for an hour and a half, like a giraffe getting a drink in the Serengeti. But the difficulty is that nobody can see the work after it's done. You know, but the difference is they can speak and they can eat and drink without food coming out of their nose. So functionally, it's an important surgery.